morning and welcome to Chamber Chat. My name is Linden. I am the Event and Marketing Coordinator for the Watertown Area Chamber of Commerce, and we are here at Watertown Regional Medical Center for a great chamber chat with some of our surgeons from the Orthopedic and Spine Centers of Wisconsin. So first off, we're going to introduce who I have here with me today.
Thanks for having us. My name is Kash Ali. I'm an orthopedic surgeon. My subspecialty is within sports medicine. So that encompasses, seeing younger patients with athletic injuries, but also some of our older patients who just kind of have chronic aches and pains and just want to live a more active lifestyle, specializing in joint replacement surgery at the shoulder, hip, and knee, as well as doing minimally invasive surgery for the shoulder and knee. So,
my name is Brian Christie. I'm a hand and upper extremity surgeon. So that primarily means nerve surgery, wrist surgery, hand and finger surgery, whether that's injuries, carpal tunnel, or arthritis.
And I'm Jason Sansoni. I'm a spine surgeon, which is precisely as it sounds, both surgery of the neck and the back.
Wonderful. Well, it's wonderful to have you guys here in Wisconsin. So why don't you tell us a little bit about the Orthopedic Spine Centers of Wisconsin and what brought you to Watertown and kind of what you're doing here at the medical center?
So our practice is an independent practice of 13 orthopedic surgeons, and we all previously left employment from large health systems to open up an independent practice, which we did 2 years ago. Our first location was in Madison, but since that time we've really tried to spread out into many of the surrounding communities throughout south central Wisconsin, throughout the region. And we've done so through varying levels of hospital and health system partnerships. But truly, what we've done here in Watertown is the first time we've ventured out to open up a clinic that's within our own practice. So we have our independent clinic here, and we work very closely with the hospital locally, but it really is kind of, the way I think of it is, it really is kind of a second headquarters for us. We have all of the subspecialties within orthopedics represented here that come here on a regular basis. And as I've been saying around in the community for some time, there's no orthopedic condition, injury, or diagnosis that would need to leave the community here because we've brought all the subspecialists to the community.
Wonderful. What are kind of the specialties that you do? I know you touched on a few of them, but there's more doctors than just you three. So what does it all encompass, all the things you can help us with?
So it kind of runs the gamut, as Dr. Sansoni said, from kind of head to toe, quote unquote. So we have physicians that take care of chronic spine conditions, degenerative disc disease. We have from the shoulder to the fingertip. I specialize in shoulder replacements and minimally invasive procedures for the shoulder, like rotator cuff tears. We also have physicians for the elbow and hand. And then from the pelvis down to the toes and foot and ankle and joint replacements. And also, we also cover the emergency department here in Watertown. So anyone who comes into the emergency department here with a broken bone, broken hips are obviously very common in the winter months, slip and fall injuries or athletic injuries from weekend sports. We see all that stuff. So.
Oh, wonderful. So what advanced treatments are available? Robotic assisted surgery, rehabilitation programs, things like that?
So I think a lot of that depends on individual subspecialties, but with each of our surgeons being subspecialty and fellowship trained, that means that each of us really are in tune with the most advanced literature and the most advanced technologies. Mm-hmm. So for example, in hand and wrist surgery, which is really my area of expertise, we routinely offer endoscopic carpal tunnel releases for patients, which is something that I think is unique in our ability to offer the Watertown community.
Wonderful. So how do you guys provide the convenient access? I know you said that you service the emergency room, but other than that, scheduling, if I were to get referred, how does that whole process work? And as a patron and a patient, what would that look for me?
Yeah, so it's a great question. So, we really try to have an intact triage system from an operational perspective, so that in the event that patients call, we're able to pretty quickly figure out the immediacy of need. So if certainly from the perspective of if there's an urgent or emergent need, we are able to see those patients right away. For the remainder of the more elective or chronic conditions, we want to make sure a couple things. One, that you get in with a shorter amount of time, wait time as possible, but secondarily that the person you're seeing is actually the specific expert that you need to see for your condition. And so it's kind of a combination of availability of subspecialty as well as availability of appointment times. And we do a really great job, and our frontline staff in Watertown is fantastic and does a really great job of interacting with patients and making sure they understand the scheduling.
Wonderful. So OSCW, you guys have a partnership with the Healthcare Outcomes Performance Company, or as I've seen on your website, HOPCO. It's down there on the bottom of your logo. What is HOPCO, and what is the significance in that relationship?
Yeah, so HOPCO really, if you want to think about it in kind of ostensibly, it's effectively our back office.
Okay.
So, it allows us, HOPCO as an organization allows us to do what we're trained to do, which is take care of patients. And when we opened up the independent practice, we never, I think, realized even the extent to which there's so many functions that occur behind the scenes to make a clinic and a practice run. So this spans from marketing to analytics to strategy to business development to operations to marketing to so on and so forth, credentialing, insurance contracts, so on and so forth. And so they're effectively our management company, and really, I think more specifically, they're really a great partner for us. I mean, we couldn't have done what we've done to date in the first 2 years of being open without the support of HOPCO.
Wonderful. Few more questions. So how do you guys focus on value-based care to improve patients' outcome, access, equity, and just like the overall experience? Like why should we come to you?
I mean, I think what we as a group are able to do is, because we're a kind of private group, we're able to really put patients at the center. We're physicians, and so we're surgeons, and so that allows us to focus on the patient and on the outcome as the primary goal. That combined with, so that I think that delivers a lot of value in and of itself. And then to add on to that, because every orthopedic condition can be cared for by a subspecialty trained surgeon, that allows us to deliver a level of care that I think has kind of henceforth not been seen in Watertown. And so what that allows us to do is deliver a really high level of quality on a consistent basis. And so that high quality while also putting the patient at the center really translates into value and value-based care for all of our patients.
Yeah, absolutely. It's very exciting to have you guys here in Watertown. My last question that I have is kind of, how do you see like you being more involved in local communities, becoming a part of Watertown? You joined the chamber, so that's your first step. You're here at the hospital, but kind of do you have a vision of what some things might look like in the future?
I can speak from a sports medicine standpoint at least. One of the things that is part of my practice is taking care of athletes. And so partnering maybe with some of the local high schools around town, making sure that all their games are covered and making sure the athletes are getting the appropriate medical care that they need when they do have these acute injuries and they need to get back on the field. Other than that, reaching out to local businesses, forming relationships, forming bonds with anyone, just like any other business that comes into a new city, so making sure we're around and we're available. And
yeah. Awesome. Well, if you need to come to the Orthopedic and Spine Center of Wisconsin, they are in the medical building in the Watertown Regional Medical Center, so it's not the hospital. You drive down the road, it's a little separate building. Park right in that parking lot, and then it's Suite 1008, and they would love to see you, talk to you, and help you with any of the situations that you may have. Thanks for tuning in.
Thank you.
Thank you.
Thanks.